Information alone doesn't change behavior, but social norming does change behavior. Most people don't change behavior when given information. So you ask, I don't know about Taiwan, but in most countries, smokers know the problems of smoking better than the people who don't smoke. They have all the information. They don't need more information, and they continue to smoke. Now, granted, it's addictive, but this is quite true in many, many things that tell people they have the information, they can tell you the information doesn't change. I'll give you another example. Again, I'm not an expert on Taiwan, but in the United States, if you ask parents of children about eating as a family, the importance of eating all together, very well established. Better nutrition, less obesity, better in school. Eating with your children is one of the best things you can do for them. And yet, the proportion who eat with their children is a third. Tells you that they have the information, they think it's important, and they don't do it. There's a very big disconnect. All right. More importantly, you're not going to get people to respond to information when there's lots of misinformation about the benefits of a vaccine, when the situation changes and the advice given by experts changes, and people begin to doubt who has expertise. This leads to another conclusion, which is it's easier to change the environment than it is to change human behavior. So, for example, cleaning the air. I don't know how good the air is in the School of Public Health. I've been to School of Public Health. They're usually not very good. Maybe you have an expert on faculty in air quality. But in general, changing air quality or installing it's also important to remember that incentives work. People do respond to incentives. So having a workplace vaccine mandate works. Turns out in the United States, when an employer says, we're going to mandate everyone get a vaccine, people line up and they get a vaccine. Some people complain, a small number. They're very loud, but they complain. But it turns out over time, they actually accept the vaccine. So we can do social norming. This is what people ought to do. That actually is one reason why more people in Taiwan wear masks, right? The social norm in Asian countries is wear a mask. If you're having a cold or sniffles or something, you wear a mask. It's not the case in the United States, not the case in Europe, not the case in most other countries.